To go. Don't look at it as physical therapy. Look at it as you're going to be amongst friends that want to see you get better. You're going to be with people that know what they're talking about, know what's going to be asked of them. You're going to be with people that care about your well-being, care about your future, care about everything that your day-to-day life activities are. Not just, okay, hey, you're another person, you're another patient, you're another number. Hey, let's get you in, get you out. They actually talk to you. They want to know about you, about your life, what makes you go. And then they kind of put that into your everyday physical therapy activities. And it goes a long way.
So I came in because I was having some Achilles pain. I was having trouble walking, just like normal everyday things. Couldn't stand for very long, and by very long I mean like not even for a few minutes. And so I came in like really struggling to do all of these activities. And I've been here for a couple months I think now. And now, able to walk, no issues, and all my daily activities like are a breeze again, which is so much of a relief to be able to do that. And not just that, I can go back to some of my activities like dancing, hiking, and running and stuff like that too. So.
Alright, I'm Devin Pereira. I'm a senior at Montvista High School. I play field hockey. I usually play the midfield positions, but this season I've been playing more of the center back. I've been a part of the Beyond program for 3 years. I think that the Beyond program does a really good job in preparing our team and our athletes for the game that we play, in the sense that we condition physically, like strength condition, to avoid injury in our play. Personally, I think that I have avoided injuries to specifically my knees and my ankles. I haven't had them before, but I do know that some of my teammates have had decreased instances of knee and ankle injuries since the Beyond program was working with them.
My name is Danny Beiser, and I am the JV head coach at Montvista. So I was a player here from 2009 until 2012, and it seemed like every week a new group of girls had a new injury: hips, knees, ankles, all of the stuff you can imagine from not using proper form. And from having breakthrough here, we've definitely benefited from a lower injury count because our athletes are learning the proper mechanics from day one when we get them as freshmen, and that's really visible in our senior class. They're actually going through all the drills, doing all the training with the proper form and mechanics. It's definitely made a difference.
Hi, my name is Severin Quimu, and I've been to BreakThrough for many years. I started 12 years ago actually, because I got a new knee, and Lee was actually my PT at the time, helped me a lot. So when later on I got a surgery years ago on my right shoulder, I decided to come back because I got such a really good experience here. And lately, unfortunately, I went to a car accident, so I got all my neck and vertigo coming up on that left side of shoulder and back. So again, I came here and now I'm all fixed. Vertigo is gone, which if I knew that before, I would have come earlier, because a few years ago I also got vertigo, and it took years to get away, which was the accident when it happened. Jinghu right away told me, okay, we're gonna do some treatment. After a month, he was already gone. So that's how fast he went. And same for the shoulder, I'm able to go back to the gym and swim again, which I didn't swim for many years because of the injury too. So, like I said, I'm really happy. Keep myself healthy. I think it's very important. And that's also what Jinghu teach me a lot of good exercise to get my body stronger.
Hi, my name is Arvi. I'm a physical therapy aide here at BreakThrough. I like to use this peanut here to lose some tension in my back.
Hey, my name is Jake. I'm a physical therapy aide here, and I use the stretch strap to keep my legs nice and loose.
My name is Justin. I'm an aide here at BreakThrough, and I'm going to use this AirX pad today to demonstrate a single leg Romanian deadlift to work on my hamstrings and glute strength.
Back stretch, you can work your knee stretch. You have to make, and then after go back, and just like everyone was talking about, like I like to focus on the eccentric going part. Yeah. Just slowly coming down. Open up for a good twist. Move your shoulder blade and pull up the row, and obviously in front. And then it just gets patients used to activating their pecs at end range of that motion. And then go in, switch. So obviously this is for more straight bridges, straight legs, or you can
Lindsay, and I tore my ACL playing soccer. So I came to Breakthrough for my physical therapy. I feel like my knee has improved in a lot of areas such as strength, balance, coordination. One of my favorite things about Breakthrough is the people who work here because they're very supportive and encouraging. To work hard because that's the only way you're going to get better.
Hey, my name is Yeti. I was suffering with neck spasm and some neck pain, I guess almost 2 months back. And like everyone else, I visited direct urgent care and doctors. I visited all of these places, and then everyone suggested, you need to go to a physical therapist. You can't live on your ibuprofens forever. And one of the sessions was Breakthrough, and the moment I called the front desk, they immediately got the appointment set up. And Dan Lee was my PT, and he took care of the problem. He understood what the problem was initially, and then saw the root of the issue, which was my posture. And with exercises and also some stretches, he corrected those, which was the most important step. And through this process, I don't think I'll find a better team of front desk and PT and the aides who were always friendly and helpful and very communicate. They were communicating very well. Um, if anyone is thinking about popping some painkillers for their muscle pain or some kind of bone issue, all of that, I would suggest them to initially ask their doctors if physical therapy will be an option, because it's much better than rather than taking painkillers for your entire life.
My name's Dave Grissom. I originally was referred to Breakthrough Physical Therapy from my doctor. I was having some real chronic issues with my shoulder, some pain that radiated down my back, into my scapula, and then some numbness that actually came down into my fingers. So I was referred to physical therapy here at Breakthrough. Yeah, so I had tremendous amount of pain in my scapula. I actually could not even lay down. I couldn't sleep at night. I was sleeping. Where I was 2+ months ago and where I am now is I'm basically a different person.
Awesome.
Hi, my name is Justin. I am a physical therapist aide here at Breakthrough. I'm also, about a year and a half ago, I was playing pickup basketball at the local gym. I was jumping on a rebound and was sideswiped and ended up landing on my leg kind of funny with my weight unsupported and twisting over my planted right leg. And I heard a funny pop, the infamous ACL pop. At the moment, I pretty much knew what happened, but I was hoping for the best. I actually wasn't in pain. I actually got up and walked and tried to walk it off, but when I tried to do a little hop, my knee just gave out, and from then I just knew I was in trouble and I had a long road ahead. After receiving physical therapy here at Breakthrough, I realized what physical therapy is supposed to be and how much patient care I was deprived of at previous clinics. A full 40-minute session with a physical therapist here at BreakThrough makes a huge difference in my opinion. And I don't feel like I'm being rushed, and I have more time to speak with my therapist about the game plan towards full recovery and return to my activities. Previous to my experience here, I didn't even know manual therapy was a huge part of post-surgery therapy. Shanice has been very caring but also persistent in addressing any lingering issues or concerns that I have had regarding my recovery and return to high-impact activity. As a patient here at BreakThrough, I feel much more confident about my abilities and my future return to playing basketball again.
Hi, my name is Nakia. I'm a physical therapist here at BreakThrough. Today I'm going to show you 3 exercises that are safe to perform during pregnancy. As our body goes through changes with the growing baby, the muscles get weaker or tighter in different areas. This can lead to musculoskeletal aches and pains. It is important to maintain good lower extremity and core strength, lumbopelvic stability and flexibility, as well as good posture while performing normal day-to-day routine activities. These are 3 exercises that are safe to perform during pregnancy. The first one is squats. I'm going to demonstrate it here. You want to keep your feet wide apart, wider than shoulder width. Tuck your tummy in, trying to engage the core muscles. Push your hips back and pretend like you're sitting on a chair that's a little further back. Okay, so you tuck your tummy in, pretend like you're sitting in this position, go nice and deep, and then use your leg muscles to come back up and push back up. I'm going to show it to you one more time. Tuck your tummy in, push the hips back, go into a deep squat, and then push back up. You want to make sure that the knees don't cross the toes, so you don't want to lean forward too much when you do this. The second exercise is called the bird dog exercise. For this, you're going to be on your hands and knees. This engages the core, the glute, and the arms, trying to maintain that stability and balance in your body. So you're going to be on your hands and knees. Make sure your hands are right under your shoulders and the knees are right under the hips. Okay, you're going to raise the opposite arm and opposite leg in this position, trying to keep your whole body nice and stable. Hold this position for about 10 seconds, trying to keep the core muscles engaged. Come back down, repeat it on the opposite side. Trying to be as stable as you can in this position. The third exercise we're going to talk about is called the rows. For this, you want to place the band at the belly button level. You're going to wrap your hands around it, arms outstretched, a little bit of tension on there. You're pulling back, squeezing your shoulder blades back, and then relax in this position. We'll try it one more time. Pull it back, squeeze your shoulder blades back together, push your chest out, hold it for about 5 seconds in this position, and control it back. What this does is it helps maintain good posture that you can maintain while performing day-to-day routine activities. If you have any aches and pains while performing these exercises, make sure you consult your physical therapist or doctor before proceeding with them. If you are pregnant or planning for it, come see us at BreakThrough Physical Therapy and we can perform a wellness pregnancy evaluation for you to make sure your pregnancy is healthy and safe.
Hi, my name is Jordan Dangerfield. I'm a physical therapist, and today I'm going to give you an overview of the process that you go through in order to become a physical therapist. In order to become a physical therapist, one usually first obtains their bachelor's degree. Oftentimes, those students have majors such as kinesiology, sports science, or sports medicine. However, when applying to PT school, you can have any other undergraduate major as long as you complete the necessary prerequisite courses. Those oftentimes include biology, chemistry, physics, anatomy, physiology, psychology, and statistics. When applying to PT school, many schools also require you to take the graduate record examination. From here, aspiring physical therapists will go through a PT program, which generally lasts about 3 years. PT school curriculums educate their students on a variety of subjects. According to the American Physical Therapy Association, Roughly 80% of the curriculum is composed of didactic and lab study, while the other 20% is set aside for one's clinical education. Overall, PT students spend about 27 weeks in their last clinical experience. During this time, students have the opportunity to gain experience in different physical therapy settings that they would like to practice in, including outpatient orthopedics, inpatient PT settings, subacute rehab, pediatrics, wound care, men's and women's health, and more. As of 2015, all accredited physical therapy programs reward their graduates with a Doctorate of Physical Therapy degree, also known as a DPT. However, many clinicians have become physical therapists prior to the creation of the DPT and have a Master's of Physical Therapy or a Master's of Science in Physical Therapy degree. The final steps to becoming a physical therapist is to pass the National Physical Therapy Exam, aka the NPTE or board's examination. This test is administered by the Federation of State Boards of Physical Therapy, the FSBPT, and is used to assess whether one demonstrates entry-level competence after graduation from a PT program. In addition, in some states, such as California, you are required to pass a jurisprudence or law exam to ensure that all licensed PTs are familiar with the PT Practice Act and other rules which they are required to follow. I hope this video was informative and would help you out if you're applying. To those student applicants, we wish you the best of luck on your upcoming applications.
My name is Preston Miller. I came in following a surgery. I had a torn meniscus from a basketball injury.